Dalaynee was a twin, and we lost one of the twins, and Dalaynee, because it was such a unique pregnancy, had a few congenital deformities. And at birth, they were quite worried about the curvature of her spine and her hypoplastic left lung. And she has a solitary kidney, so it was a lot to take in.
She was born at 32 weeks, so she was very small. Immediately after she was born, she had a blood transfusion and she was put into the NICU. Dalaynee was born with severe scoliosis and anomalies of her spine, including a hemivertebrae in her neck. So she was crooked like this all the time, and her ribs were fused, and she had an extra cervical rib up here.
Scoliosis is when someone's crooked.
She would see Dr. Milan every 6 months, and if we needed to see somebody in between, like respiratory or the dietitian, then we'd go more frequently.
Both Tess and I made the decision that we weren't going to treat her any different.
Lainey's always done everything that everybody else does, just with some adaptions.
Dalaynee couldn't ask for a better kid. I think she has probably the biggest heart that I've ever come across. And she's always caring about others and not worried about herself.
As Dalaynee grew, her curve became more severe, and her spine was starting to put pressure on her lung, which in turn affected her breathing. So that was one of the main things that was a determining factor to have to do the surgery when we did. And so Lainey was in traction for a month with 11 pounds hanging from her. Traction is when they put a halo on somebody's head and they hang weights from it to help lengthen the spine so that when they go in to do the surgery, there's more room. And it made a huge difference when they eventually operated. They unfused the ribs, put a rod in, took out one of the vertebrae in her neck, and straightened her up.
It's difficult. As a parent, you always want the best for your children, and it was hard to see Dalaynee scared, but at the same time knowing that we were making the best decision, and with the doctor's recommendation and advice that this is the right plan, and we're very happy with the outcome.
We have 100% faith in Children's Hospital.
They know what they're doing and they do it right.
They were an amazing team, and the care, I've never been a part of something that you just felt so comfortable and informed and part of the process.
At one point, it was just kind of a dream to us that Lainey would be straight, but Dr. Milan was never a dream, it was always his plan. Lainey is your typical 8-year-old girl. She was just a little crooked. Now she's straight.